All right, so go ahead and start filming this guy.
Okay, you're on.
All right. This is a technique. Learned it in John Upledger's book back in the 80s. And he spoke of tractioning the jaw inferiorly, as in towards the feet. And it's just absolutely a wonderful technique. I have people who have resisted spring motion in their jaws in rotation and in side bending. And this technique is very effective for many of them. So if I come on this is the angle of the jaw. This is where it changes direction. Okay. If I come behind it and I lift it towards the ceiling with my thumb, I just give it a little thrust. Okay. And it moves. Then I test the other one. Okay. And it moves. I treated my jaw years ago and it has behaved ever since. And now I come underneath and I'm springing it up that way. Okay. And the first joint to move is the jaw. After that, then the head, the neck will move. Okay, but you can tone it way down, just a very small force. That's about a pound. Okay, pound of force. And if it feels really tight, say on one side or even both sides, it should have a little spring to it. Every joint has a normal spring to it. Then it's worthy of treatment. And so I'm going to first show you me treating myself, and then I'm just going to say, instead of treating yourself, you can have somebody, push your jaw down. Here's the deal. You tilt your head back very slightly, and gravity should open your jaw. Your teeth should be separated. If not, you have to consciously separate your teeth, very small amount, 1/8 of an inch, and then try to let all your facial muscles relax, and gravity will hold it open. And if I'm going to treat myself, okay, then I find my earlobe, and I put 2 fingers in front of it, but not above. If you're in front of the opening of the ear, you're in the wrong place. That's where the joint is. You want to be below the joint. Okay, so I place index and middle finger under there. I bring my elbows in and drop them onto my chest. Okay? I'm going to pull my jaw down towards my feet. Okay? So I have to kind of push in the skin a little bit to contact the bone. And I've done so. And now I'm going to pull down. But when I pull down, I use the most minimal force, pretending that I am, with both hands, bringing a little salt shaker, sliding it so slowly on the table. Okay? Less is more. I'm not trying to physically gap the joint. More force would do that. I am inviting the nervous system to pay attention to your jaw. And it does so. And we could use fancy terminology, and I could talk to a neuroscientist. They could help me write up a gorgeous paragraph with lots of $20 words. I'm going to do it with a metaphor. I invite the nervous system to pay attention because this is a very unique sensation. And so the nervous says, what's Jerry doing? He doesn't do this. What is he doing? This is new and different. And then it says, this is interesting. The jaw muscles are rather tight. Why are they tight? Let me look at the schematics. So it pulls up the body schematics, the template for that joint and those muscles and ligaments and fascia and all that tissue. And the nervous system says, hey, you know, that ain't right there. That's working too hard. Let me send a text to the guy behind the curtain. So sends him a text, sends him an image. The guy behind the curtain wakes up, takes a sip of his coffee, and says, what? Oh yeah, Jerry's jaw. Yeah, there's this, yeah, that ain't right. And he starts turning the dials. And all of a sudden, it melts like butter.
After how
And
many
it
minutes?
feels wonderful. I recommend 3 minutes.
Okay.
And I recommend it once a week.
Okay.
Okay? And it depends on your lifestyle. And it depends on how you manifest stress in your body. Me, I did it once, and the mobility was restored, and that's not where I store my stress. And I will test it on occasion, but it's not something I need. But some people really benefit by doing that. And it's nicer if someone does it to you, because then you can be totally relaxed. Okay? And so they're simply contacting you in front of the earlobe with 2 fingers, but they're pushing it towards your feet, okay? And less is more. In fact, when I treat someone and I engage the bone and then I push down a little bit, I then back it up, where it's like such minimal force. Try it. You'll find less is more. Thank you.